Countryman here. 35 plus years as being a massage therapist. And in the YouTube videos, we're supposed to promote our technique. And yes, I do teach a continuing education course called Structural Relief Therapy. But today, I'd really just like to share some wisdom before I forget, right? Because I'm getting older every day. I want to talk about how you as a massage therapist really need to feel before you treat. Well, I understand that sometimes people come in and they're just really stressed and they just really need some deep relaxation. Yep, go for that right away. But when you have patients that have some limited range of motion or they have some pain and some symptoms, I think our compassion as a massage therapist says, I just want to get right to it. But I want to say this really firmly so you understand that assessment isn't any one thing. It isn't just what they write down. It isn't just what they say. It isn't the test that you might do on their body. It's those three things compared to what you feel. And we are so eager to get started that I think sometimes we forget. I took a class from Dr. Lauren Rex, who was an osteopath in the area that I live, which is north of Seattle. And the first thing he said in the very first class was, how much pressure do you need to apply to the body to engage the fascia? I froze. In the early 80s, the only thing I knew about fascia was Ida Rolf, and that seemed to be all deep work. And what did he mean? And how many pounds of pressure? What are you talking about? Well, a lot of you have been to some really good schools, and so you do know what I'm talking about, but I want to remind you. Take the time, go to a grocery store, especially one that's open late, 24 hours, so that you can practice on their scale. You need to be able to chart to a half a pound, 2 pounds, 3 pounds, and 4 pounds of pressure. Because when you can chart that they have pain with less than a half a pound of pressure, that makes a huge impact on the person who reads your chart notes. Now, the other thing that he taught me is the tips of your fingers and the tips of your thumb, that's not where you feel. You want to use your whole hand, as many sensors as you can. That does not mean the heel of your hand. And when you really go to feel, you need to not be pushing your body weight. So I have 3 magic fingers that I use when I assess tissue. Sometimes I'll just put my hand there and use my whole hand, but when you're first learning, these 3 fingers are really great. Let me show you how that works. I'm just going to do that on his lower legs. This is Eric, by the way. And I'm going to just squish the tissue. And the reason these fingers are great is that they will give. And so I can't put my whole body weight like the heel of my hand. Like I said, I can just use my fingers to feel what feels tight. Ooh, and he feels tighter on this side. And I hope you can see how the tissue either gives or it doesn't give. I'm going to demonstrate that also on his piriformis. So here's Eric's sacrum, here's his hip. So if we draw a line across it, I want to squish across those fibers. So I'm going to use my hand here to push, and then I'm going to use my other hand to push. And I really hope you can see that I can get much deeper with the same amount of pressure on his right side than I can on his left side, which means his piriformis is tighter on that side. The other thing that he taught me to do is that whole hand thing. Just let your hand rest in the area of where you think there might be something going on and relax yourself and wait for it. Because did you know that your own body knows their body better than your intellect does? Your intellect it can lie. But bodies don't lie. You know that. They're honest. They're always trying to tell us what's going on. So sometimes if I just put my hand there and wait, I can sense through the layers of the skin, the fascia, the first layer of muscle, the second layer of muscle, and as I just relax and let myself be, I can feel even deeper into the core of Eric. And I can wait to get some kind of internal signal as to how much tension there is. Now, if you're suspicious from what you feel, you can always have them engage a muscle to make sure that's the muscle that you feel that's tight. Please, slow down, take some time to feel, and use what you feel in your assessment to compare that to the other things they have written down, they've said, they've tested, and you've observed. And I really hope that I get to meet you in person at one of our classes sometimes, because I love what I do and I know you love what you do, and let's all develop a better sense of touch. See you at a class.